afternoon. I'm IBDAP26Deep, or Max. I'm from Phillips Exeter Academy and in the US, and I'm currently in grade 10, or MOSE.
And my name is Punutaisan, and I'm from Harrow, Bangkok, and I'm also in grade 10, or MOSE.
So today I'm here presenting deep learning algorithms for automated classification of pre-ulcerative plantar calluses and corns. So, diabetes is a common problem plaguing people all over the world, with 537 million people with diabetes worldwide by 2021. And it is expected to reach around 800 million by 2045. A person with diabetes has a lifetime risk of 19 to 34% of developing a foot ulcer within their lifespan. And once that ulcer forms, they have a 30% mortality, 5-year mortality rate, or otherwise a 30% chance to die if within 5 years. And it's comparable to many other cancers as well, and it is the #1 case of non-traumatic lower limb amputations worldwide. So, how do ulcers form? One of the core symptoms within a diabetic patient is peripheral neuropathy, where they lose pain sensation within their lower limbs and within their limbs in general. And through repeated shear and pressuring of the foot, calluses can form. And once those calluses form, if left alone and long enough, the tissue is able to break down and lead to an ulcer, which could then cause complications such as amputation in the worst case. One of the most common ways to fix and prevent these issues is through these various methods, such as screening, offloading, education, and debridement. But as you can see, callus stands right in the middle as both the symptom and the cause of the ulcer. And the callus is like a key pre-ulcerative lesion that, if caught in that stage, can be allows us to take care and deal with the ulcer beforehand. And preventing is the best step and the best way to treat something. So, classification using CNNs is no new technique. It has been used and applied in various AI methods and in various health fields already. And as you can see here, diabetic foot ulcers have been commonly done using various methods and through many data sets. However, our paper targets callus data sets in which there are much less. For example, this one in 2026 has callus but does not include the ulcer scale and the normal scale, where this one in 2022 has thermograms instead of photo imaging and clinical photographs, which leads us to our accuracy classes. So for our classes, we split them into 5 grades. Normal, which is just a typical normal foot, all the way to the ulcer as a developing pathway of the issue and as a overall continuum. As you can see, one specific feature of our classes is we've split it into light and hard callus, with the difference maker being light calluses. Patients are able to do self-care and perform self-care. However, on hard calluses, it requires nurse caring and with various other issues. Corn is also a standalone issue with nucleated keratin plugs, also leading to ulcers but separate from calluses themselves.
For our method, we began with data collection, and then the data set is partitioned into training and validation and testing data set following an 80 to 10 to 10 ratio. This is important as the partitioning should be performed before augmentation to prevent data leakages between the training and testing subsets. We then trained and evaluated 8 ImageNet pre-trained models using a transfer learning approach. The training and validation data was then used for model development, whilst the test set remained completely unseen until the final evaluation. Finally, model performance was assessed on the held out test set, and the best performing model was selected for the for the classification. Now that we've seen the workflow, let's take a closer look at the data set. Our data set consisted of 1,631 images in total, and we collected them from publicly available sources and screened to remove low quality and irrelevant results. The retained images were then classified by a surgeon and 2 specialist nurses into 5 different categories. As shown in the table, the data is imbalanced, with the corn class containing fewer samples compared to the other classes. To address this problem, we applied augmentation only to the testing set. The corn class was the main focus here, as it contained only 119 images before augmentation. So, we increased the number of training samples using rotations, flips, zoom cropping, brightness, contrast adjustments, and elastic distortions. With the data set prepared, we then evaluated a range of ImageNet pre-trained CNN architectures using a transfer learning approach. Rather than training from scratch, we froze the pre-trained feature extraction layers and trained a new classification head on our data set. All models were trained under the same conditions using early stopping based on validation loss, and the best checkpoint was retained for testing. Performance was then evaluated using accuracy, precision, recall, and F1 score. Because the data set is imbalanced, these metrics were recorded as weighted averages. The training configuration used for all experiments is summarized here in the parameter settings table.
So for our experimental results, we found out that Convenex Large performed overall the best compared to the various other CNNs, and augmentation itself did not specifically improve each and every one of these models, with some improving and some reducing as well. As you can see here, this is a confusion matrix for the Convenex model, where our model actually was able to perform with high recall standards for normal and ulcer and corn as well. However, it confused light and heart callus specifically, as would most normal humans, and light and heart callus separation typically requires specialist treatment and specialist view to be able to discern the splits, and so our accuracy of 79.8 is somewhat deceiving, as our recall for other classes stands fairly high. We've also developed a web app using our pre-trained models so that people and patients are able to upload their models onto our website and able to classify. We have samples and explanations of each and every part. So, in conclusion, we've developed 1,631 images as a new novel data set that's been classified with 8 CNN backbones benchmarked that have been used in the current system, achieving an accuracy of 79.8% with our Convenex X large model. And this currently stands as a baseline and a step forward in the right direction. Thank you. Any questions? And also, the QR code's right there if you want to scan for the web app.
Thank you so much. Thank you.